Assalamualaikum and good morning. My name is Nur Afza binti Khairul Anwar. My metric number is 200257.
My name is Amir Harzidi Ajman and my metric number is 200776.
My name is Nur Fatmi Iza binti Rozuki. My metric number is 200844.
So today we're going to present about the nursing role in pandemic management. But before that, I'm going to tell you about our content for today. Firstly, I'm going to talk about definition so you can understand the meanings of pandemic, COVID-19, and nursing. Next, I'm going to start with the first point, which is spreading awareness and knowledge. Then, my friend Amir will talk about managing medical supply and equipment and enforcing sanitation. Lastly, my friend Iza will talk about patient care. So let's get started. What is pandemic? A pandemic is a worldwide spread of a new disease. As you guys know, COVID-19 is a new disease that has spread all around the world. This is why we say COVID-19 is a pandemic. So next is COVID-19. COVID-19 is an infectious disease caused by coronavirus, a type of virus known to cause respiratory infection in humans. Why do you think we call it as COVID-19? So COVID-19 came from abbreviation of CO stand for corona, V for virus, D for disease, and 19 came from when we first found this disease in 2019. The first case of COVID-19 in Malaysia was detected on 24th January 2020. And lastly is nursing. Nursing encompasses collaborative care of individuals of all ages, families, groups, and communities, sick or well in all settings. Nursing includes promotion of health, prevention of illness, and the care of ill, disabled, and dying people. Next, I'm going back to our main topic for today, which is nursing role in pandemic management. Firstly, is spreading awareness and knowledge. According to Gallup's ethics survey, nursing was ranked the most trusted profession for nearly 2 decades in the United States. This is why nurses must teach others everything they practice, from symptom awareness and sanitation to disease prevention. Information on things like proper hand washing, social distancing, and also sanitation can be found from many sources and also from unknown sources. So that's why nurses need to educate people by spreading awareness and knowledge. So while I'm at it, as a nursing student, I will tell you the major symptoms for coronavirus according to CDC. Number 1, fever or chills. Number 2, shortness of breath and difficulty in breathing. And lastly, cough and sore throat. And some people also may have headache, new loss of taste or smell, fatigue, muscle or body aches, and diarrhea. If you have these major symptoms, please go to the hospital to get tested. These symptoms may appear 2 to 14 days after exposure to the virus. This is why quarantine for 14 days is needed. Lastly, for my slot, emergency symptoms. For emergency warning signs for COVID-19, if someone showing any of these symptoms, please immediately seek for emergency medical care. First one is trouble in breathing, persistent pain or pressure in the chest, new confusion, inability to awake or stay awake, and lastly, bluish lips or face. So that's it for spreading awareness and knowledge. So I will pass our presentation today to Amir.
Okay, now we proceed to the next main point, which is managing medical supply and equipment. Okay. Next. Okay, under this main point, I have two supporting details, which is unified scheduling and daily supply, and then attention to details and efficient usage. Okay, the first supporting details, which is unified scheduling and daily supply. So, as what we know, nurses is the first line of medical staff, which is requires large amount of equipment as this pandemic has high infectivity. Uh, uh, this is because, as well we know, nurses are the one who take care of the patient during their working hours. So their contact with the patients are more longer compared by the doctor. So because of this long activity of their contact with patient, the transmission of the disease may acquire. So these these personal protective equipment are important for them to to get rid from getting the infection of the disease. So as we know, this COVID-19 has infection by droplet and contact transmission. So how the healthcare workers how the healthcare workers to want them to unify scheduling and daily supply. So by this distribution system plays the important role for them to get scheduling supply of the personal protective equipment. For example, surgical mask, N95 mask, and gloves are the most use of the personal protective equipment. So these equipments are highly used by the healthcare workers and need to schedule and get daily supply for the healthcare workers during their working hours. So uh, how how the scheduling and daily supply can use by the head nurses of wards, which is sister, took charge from the requisition until the distribution of the consumable. So this is the effective ways uh, of the healthcare workers to get sufficient of personal protective equipment. So the head nurses have to request and then storage and distribute to the nurses in their wards for them to use the PPE. And then the head nurses of ward also have to communicate with the nursing department and materials department every day for timely supply. Okay, so this evidence I get by this journal, which is Emergency Management of Human Resources and Supplies to Respond to Coronavirus 2019 Epidemic. So this journal is it show how the healthcare workers in hospital at China unified their medical supplies and equipment. Okay, next. Okay, next is attention to details and efficient usage. Okay, by the title, we can get about how the healthcare workers can manage the equipment is by at, attention to the details of using of PPE. So, organized training and implementation of the equipment is important for them to document the common use of the personal protective equipment during COVID-19 control. And then formulating usage rules of PPE for effective duration and maximum usage of every set of PPE. So in in China, in hospital in China, the healthcare workers formulate this usage rule for them to effective to use the effective duration of PPE and maximum usage of every set of PPE. This is because they don't want to waste the consumables of PPE because as what we know, this PPE is the most important thing medical healthcare workers during their working hours. Okay, and then complete their personal preparation like drinking water, eating, urinating, and defecating before wearing PPE. So these are the examples of how healthcare workers can use their PPE effectively and maximize the usage of their PPE. Okay, and then additional refreshment in case of response to accident. Okay, this is why in the wards the head nurses of the ward at two to three additional PPEs for the healthcare workers use. This is because to respond to the accidents such as vomiting or syncope that caused by long-term of hypoxia, deprived of adequate oxygen level in medical staff. This is the common accidents that acquired by the healthcare workers when they wearing the personal protective equipment. Okay, next. Okay, next we'll go to the enforcement sanitation. So in this main point, I will present about how the healthcare workers should adhere to my WHO, my 5 moments of hand hygiene, and giving seminar or educational to infection control. Okay, next. Okay, first, this is the picture of how there are the techniques of the right way to wash your hands. First, wet your hand under the running water, and then apply sufficient soap and rub palms together, and then spread the soap lather over the backs of the hand, and then make sure soap gets in between fingers, and then grip fingers on each hand, and make sure to clean the thumb. Yes. And then press the fingertips into palm of each hand. And then the last one is dry thoroughly with clean towel or paper towel. So this is the right way to wash your hands. Okay, next. Okay, as what we have as what I presented before, the right way of hand hygiene. So the healthcare workers are required required them for to keep their hand hygiene. So to enforce the sanitation, the healthcare workers like nurses need to use these 5 moments of hand hygiene for them to keep their hygiene. Okay, what are the 5 moments for hand hygiene? First, before touching the patient. Second, before clean or aseptic procedure. Third, after body fluid exposure or risk. And then fourth, after touching patient, and the last one after touching the patient's surrounding. So these moments are required for healthcare workers to wash their hands after that. Okay, so what are these hand hygiene? So this hand hygiene is, first moment of hand hygiene is evidence-based, field tested, user-centered, that designed to be easy to clean and logical and appliance in wide range of settings. So this is evidence-based of how the healthcare workers and the public can wash their hands in the right way. So in existing reports, the hand hygiene are often neglected by the healthcare workers, either in developed or developing countries, by which compliance rates sometimes slipping below 20,000. Why are these hand hygiene neglected by the healthcare workers? Because of the crowdfunding of healthcare facilities, lack of disinfection zone, and lack of access to reliable and adequate ADHR. Okay, so in order for healthcare workers to keep their hand hygiene, not only by get their hands hand washing, but they can also apply alcohol-based hand rub. So this the techniques to apply this alcohol-based hand rub are similar to the hand hygiene. Okay, so the adherence to infection prevention and control guidelines is vital in combating the current pandemic, as these nurses are the medical first line of medical staff that like what I said before, have high longevity contact with the patient. So healthcare acquired infection also could be avoided by well-trained nurses with appropriate hand hygiene compliance. Okay, next. Okay, now we go to the next supporting detail, which is provide weekly educational seminar on infection prevention and control practices. Actually, these ways are applied by our government also. So, in this point, I get the research by done by Saint George Hospital University Medical Center in Beirut, that there has been that, that there has been established a daily detailed email updated on self hygiene and the COVID-19. So this is what also our government do from the start of the COVID-19 until this day. And then multiple COVID-19 care services have been established, including a corona clinic, and weekly educational seminars are provided on infection prevention and control practices, and a direct channel of communication with the entire hospital community. So this is what the healthcare workers should do in order to provide educational seminar of the enforcing the sanitation by weekly educational seminar to the healthcare workers, or maybe to the public also. So that's all for my part. I will pass this presentation to the next presenter.
Last but not least, role of nursing in pandemic management is to provide patient care. Next. Nurses are important in managing a health crisis because they are a vital link between the patient and the rest of healthcare team. Because instead, as we know that they are with their patient for the whole shift. Through assessment and critical thinking, they're able to notice subtle change in their patient, whether they are decomposition or getting worse or getting better. Instead of that, while world is in better against COVID-19, nursing are facing this threat head-on, directly interact with countless patients who may be carrying the virus. Their role is critical to the entire healthcare operation and pandemic response, which are processing, assessing, and treating patients quickly and efficiently. Next. Nurses are ideal for this task because their existing experience working by tapping into the experience, the spread of infection can drastically limited. For example, patients who test positive or show symptoms are quickly moved to the quarantine, protect other patients who may be not carry the disease. Instead of that, they also can assist the client physically and psychologically, such as caregiving the developmental, cultural, and spiritual levels. Next. For example, something that you have to remember with the Hildegard Iplau has said that nursing is therapeutic in healing or assessing an individual who is sick or in need of healthcare. Next. Okay, our nurses are our hero. In conclusion, nurses are formed and centered around the clock to protect the health and well-being of patients. As we can see right now, Nurses are already accomplished their job by slowing the spread of disease and reduce patient death. Despite the struggle and frustration and risking associated with their job, nurses around the world remain strong and steadfast in the face of overwhelming odds. It will forever be appreciated by those who receive their helps. Even with many evidence in healthcare and technology, any progress in effectively combating the COVID-19 virus could cease to exist without the aspect and composition care of nurse. As nurses with considerable expertise as healthcare, we are very proud of nurses everywhere of their provide service during this pandemic management. Nurses will always be on the frontliners, caring for the world and largely beyond our current global pandemic. I think that's all from us. If you have any question regarding our topic, you can ask and let me know. Okay, that's all from us. Thank you.